Myself, Dr. K. Kasturi Devi, working as Assistant Professor in the Department of Veterinary Pharmacology and Toxicology. Anti-helminthic resistance. So the term resistance in view of the sheep and goat. So we use the term resistance whenever it is referring to the ability of the parasite. So whenever the parasite that is present in the animal is having the tolerance towards the drug action. So when the parasite is having it has developed the tolerance or drug tolerance towards the drug action and is able to survive at a recommended dose, which is susceptible earlier. Then we use the term, there is development of resistance. Means it is the ability of the parasite to show tolerance or it is able to withstand the drug action and is surviving at the recommended drug dosage. But the same parasite which is susceptible in earlier treatments, but it is now showing the tolerance. Then we refer it as development of resistance. So in case of resistance towards the anti-helminthic drugs, we call it as the term as anti-helminthic resistance. So why the problem of resistance is major in case of gastrointestinal nematodal parasites? Because usually the parasites that are present in the small ruminants, they are usually having the heterogeneous group of population. This particular worms, usually they are present in 1,000 in numbers. They represent the heterogeneous group of population, and this particular heterogeneous group of population, they will be undergoing constant genetic variations. And these constant genetic variations which are occurring as a result of frequent genetic recombinations. So these frequent genetic recombinations are resulting in occurrence of resistant genes. So the parasites which are harboring these resistant genes as a result of frequent genetic recombinations, they are able to withstand the drug. So these particular parasites are referred as the resistant parasites. Okay, so this table, this is the timeline that is indicating the introduction of different classes of anti-helminthic drugs, which we have discussed earlier, like benzimidazoles, tetrahydropyrimidines, macrocyclic lactones. So here, if you can observe, so this is the numbers which are present above the timeline. So these are indicating the years that are introduced or where the approval, these drugs are approved for the release into the market. And the bottom years are indicating the year of resistance reported. So when you compare the year of approval or year of release of drug into the market and year of resistance reported against these drugs in the parasites, so there is the range is within 3 to 9 years. Many of the drugs in these classes, they have developed resistance or parasite is able to tolerate the action of these drugs. So what are the causes of this anti-helminthic resistance? Why there is a development of resistance at a rapid rate? Because one thing is frequent deworming in a farm. So indiscriminate frequent deworming in a farm or treating all the animals in a farm, like whether the animal is showing symptoms or not. When one animal is showing the symptoms, if you are treating all the animals in the farm, or usage of the same drug repeatedly without any change, if the same class of drug is being repeatedly used for deworming purpose or underdosing of the drug. So if you use the same dose for all the animals in the farm, which will result in underdosing. So there will be certain animals which are having the more body weights, and whereas some certain group of animals will be having the underweight. But if you are dosing same dose of drug to all the animals, it may result in underdosing. The important point that we have to remember is extrapolation of the dose. Extrapolation of the dose means you are having the dose of a particular drug in only one species, and you don't know the dose that is indicated or dose that is to be recommended in the other species. So when you are using the same dose in both the animals, it can result in underdosage in particular breed species. Why? Because in case of sheep and goat, if you compare, most of the farmers, the common mistake they do is they recommend or they take the same amount of drug in both the species. But the dosage requirement in case of goats is higher than sheep. Why? Because goats are having the higher metabolism, or their liver is having the higher metabolic rate. So higher metabolic rate means the drug is rapidly metabolized in goats. The same drug when you have given the sheep and goats. In case of goats, the drug is undergoing rapid metabolism. Rapid metabolism means rapid elimination from the body. So the drug is being eliminated faster in case of goats. So that's why the dose of the drug is usually double in case of goats. And in case of levamisole administration, that instead of doubling the dose, it should be 1.5 times of the dose that is indicated in case of sheep. So how can we optimize the development of this anti-helminthic resistance? So to optimize or to control the development of the, to delay the development. So rather than, we cannot completely eradicate the resistance, but we can only delay the development of resistance towards this anti-helminthic drugs. So this can be achieved by integrated parasite management. So the meaning of integrated parasite management is nothing but it is a combination of different methods to control the situation. So to control this anti-helminthic resistance, various aspects such as right proper usage of the anti-helminthic drug, or scientific or judicious or most scrutinized uses of the drugs that are available for the treatment, and good managemental aspects. So good managemental aspects, again, it is the backbone for the survival of any farm with the profits. So where the good management aspects includes, starts with the provision of good drinking water, good quality of drinking water to the animals, provision of good nutrition to the animals. Nutrition again includes, like, depends upon the stage of the animal, like lactation or pregnancy. So depending on the growing lambs, so depending on that, again, the nutritional demands will vary. So provision of nutritional requirements depending upon the stage of the animal, and also maintaining the stock density in the farm. So the stock density has to be maintained in the farm, as well as the stock density should also be maintained when the animals are sent for grazing. So in both the cases, if the stock density is increased, means there is increased chance of contamination, as well as increase in the chances of infection from one animal to the other animal, and as well as following of rotational grazing practices. So following of rotational grazing practices, or giving a rest period for pastures. So when particular pasture is grazed for a period of time, that particular period of time should be followed by the rest period to the pasture. So these are certain pasture management practices to be followed, and as well as nutritional supplements, and also reducing the chances of contamination, and preventing the grazing areas, like preventing the animals to graze near the manure pits. So usually whenever the infected animal is there, the feces of the infected animal will be rich in with the eggs, and these eggs will hatch to larvae, and these larvae will be easily traveling from the manure pits. Up to 12 inches of distance they can travel. So that's why we need to prevent the grazing of the animals near the manure pits, as well as preventing the grazing of the animals like close grazing. So since these larvae which have hatched from the eggs, they can travel up to 1 to 2 inches of height from the ground. So preventing of close grazing nature. So these are the certain aspects that have to be kept in mind for managing of the farms. And another important aspect is maintenance of worm refugium. What do you mean by worm refugium? So the worm refugia means nothing but it is there. These are the worms in refuse. So what do you mean? How they help? How the worms can help? So refugia worms means these are particular worms in a worm population in a flock. Refugia worms. These indicate that these are particular worm population which are not exposed to the anti-helminthic drug. So refugia represents the worm population that is not exposed to the anti-helminthic treatment. So maintenance of refugia population means preventing, like we have to refrain deworming of all the animals in the farm. So what happens actually if you are not maintaining the worm refugia population? What happens if you're treating all the animals in a flock, if you're treating? So what happens upon treatment of all the animals in the flock? So without maintaining any refugia population, so whatever the susceptible parasites are present in the animals, they die, and whereas the resistant worms, they remain. Only the susceptible parasites will die, but there will be remaining resistant parasites, they will remain. So there is no competition for the food, so they can easily reproduce and transmit these particular resistant genes to the next generation. So next time when you see the next generation parasites, you will see only the resistant worms in the animal. So that's why in case of treatment with the same drug, there will be failure of treatment. Why? Because the worms are carrying the resistant genes. Now only the resistant population of worms are present in the animal, so which are able to tolerate the action of drug. So which will be obviously ending with the treatment failure. On the other hand, if you are maintaining the worm refugia, means if you are going for selective treatment of the animals. So this selective treatment is also referred as targeted treatment or targeted selective treatment. So targeted selective treatment means you will treat selectively, means you will basing on their symptoms or basing on certain parameters or the animals which require the treatment, they only receive the treatment. So in that case, you are giving only treatment in 50% of the flock, and whereas the remaining 50% of the flock, they are unexposed to the drug. Means the worms that are present in remaining 50% of the population are unexposed to the drug. So in such conditions, there are certain susceptible parasites are surviving along with the resistant worms. So there is reproducing of both susceptible parasites as well as resistant worms in a flock population. So in that way, you can delay the development of resistance towards a drug. So that is the meaning of maintaining of refugia population. So refugia population, so in order to maintain the refugia population, we have to follow the targeted selective treatment. Means only the whichever the animals that require the treatment, only those particular animals we will treat, and remaining animals we will not treat, basing on the need. So in that case, you are maintaining both the susceptible parasites as well as the resistant worms in a population. How can you minimize the development of resistance? So you can minimize the development of resistance. So that's what we are discussing, basing on the targeted selective treatment, and by selection of appropriate drug, giving the appropriate drug at a right time and a right dose is the most important thing to correct the occurrence of anti-helminthic resistance in a form. That is choosing of a appropriate drug, which is the suitable drug for that particular infection, administering that particular drug in a correct dose, judicious usage of that particular drug, and also making sure that particular drug is administered in a calibrated dosing equipment. So in order to ensure that amount of drug which we are delivering has successfully entered, the complete dose has reached the animal, is also important. And another important thing is proper storage conditions of the drugs, because drugs which are not stored in the proper conditions, they may lose their efficacy. And also following of quarantine measures. So following of quarantine measures means, so whenever we are introducing any new animal into the farm, that particular animal should be examined for the presence of any worms or worm infection by following the procedures such as fecal head count procedures. And after ensuring that particular animal is free from particular worm burdens, if there are any worms, treating the animal, and further again after the treatment, again going for the fecal head count, then only we have to introduce the animal into the farm. So these are certain steps or various measures that can be taken to reduce the emergence of anti-helminthic resistance in a farm. So the term as earlier we have used it, like targeted selective treatment. So how can we approach this targeted selective treatment? There is a particular test called as FAMACHA test. So this FAMACHA test is a system that is developed in South Africa. So by the scientist called as Francois Falan Malan. So he is the person who has introduced this chart to treat the animals which are suffering with Haemonchus contatus. So this Haemonchus contatus, which is commonly referred as blood-sucking parasite, which will survive on the host blood. So presence of this particular infection by this worm will causes the animal anemic. So by using this chart, by using the conjunctival mucous membrane, we have to assess whether the particular animal requires the treatment or not. So here if you can observe, so if the color of the conjunctival mucous membrane is matching between the first two grades, then there is no need of treatment. And whereas if it is matching with the last three grades, then it is indicating that the load of infection is high, which is recommending the treatment for the animal. So basing on the load of infection, we have to select the animals for treatment. But this FAMCHAT's limitation is it is only effective in the parasites which are able to cause the anemia. So then how to detect the need of treatment, the need of deworming in other cases of infection? So there is a protocol called as 5-point check. So this 5-point check will help in assessment of need of deworming or need of therapy in a ruminant that is infected with the intestinal parasites. So this 5-point check includes, first one is I. So that's what we have discussed in case of FAMACHA score. So depending upon the severity of the anemia, we can go for the treatment, whether the animal can be included for the treatment or not. And second condition is basing upon the body coat condition. Next is tail. So soiling of the tail. So degree of the soiling of the tail or scores in the back portion will indicate the severity of the infection in case of gastrointestinal parasites. And presence of nasal discharges in case of nasal boat infections, presence of nasal discharges, and occurrence of jaw edema or intermandibular edema in case of parasites such as Haemonchus contatus. So because of their blood-sucking nature, it can result in hypoproteinemia condition. So which will be the main prominent sign in case of hypoproteinemia or lack of proteins in the blood plasma is accumulation of fluid in the jaw. So that particular condition is described as the bottle jaw condition. So basing on these 5 checkpoints, the animal needs to be assessed whether it requires the deworming or not. So whether the animal has to be included as a part of treatment or not. So next coming to the few checkpoints for the smart drenching of the animals. So first thing is find out which dewormer works best. So first we need, all dewormers may not be successful. So we need to identify which dewormer is working best for the particular infection that is prevailing in our farm. Estimation of the dewormer can be done by fecal egg count reduction test. And next is checking of the body weights. So before proceeding for the deworming, the body weights of the animals must be taken. And whereas in case of goats, the dose should be doubled. And in case of levamisole, as I mentioned earlier, it should be 1.5 times of the dose that is recommended in case of sheep. And next important thing is withheld of feed. Withheld of feed or off feeding of the animals for 12 to 24 hours prior to the schedule of deworming. So this off feeding of the animals prior to the schedule of deworming is essential because the animals which are off fed, the transit time, the intestinal transit time is increased. So increased intestinal transit time means more time the drug is remaining or more time the drug is traveling in the intestinal tract. So increased intestinal transit means increased time for which the drug is remaining in the body. And this particular feature is essential in case of drugs which are belonging to the class of benzimidazoles. Because in case of benzimidazoles, we have mentioned that the more amount of drug should be remaining in contact, more time or more amount of drug should be in contact with the parasite. And also in case of when you are deworming the farm with the benzimidazole class of drugs, the efficacy of benzimidazoles can be enhanced by repeating the oral drench 12 hours after the first dose of deworming. And next thing is simultaneous use of 2 different class of dewormers. If you are suspecting the resistance to one particular class of deworming drug, so simultaneous use or concurrent administration of two different class of dewormers can show the increased efficacy or increased additive effect can be seen against the parasites. And also next thing is drench only the animals that require treatment. So that's what we have discussed in case of pharmacia testing or 5-point check. So basing on the symptoms, we have to check whether the animals require treatment or not. So that is targeted treatment. So these are few points which have to be kept in mind for the judicious usage of the deworming drugs in animals. To enhance the efficacy of the anti-helminthic drug, so basing on the recent literature that is collected from American Consortium for Small Ruminant Parasitic Control, it is strongly recommending that combinational treatment, that is combination of drugs that are belonging to two different classes of drugs. So administration of drugs which belong to two different classes of drugs is the best method of deworming as per the literature or as per the suggestions that are given by the American Consortium for Small Ruminant Parasite Control. Under that, most common anti-helminthic combinations that are used are combination of fasciolacide in combination with anti-nematodal drug. Means that is fasciolacide means the drug which is used against the fasciol or trematodes. So combination of drug which is against the trematodes and combination of anti-nematodal drug, or sometimes if the animal is deficit of any essential elements or minerals. So combination of anti-nematodal or anti-trematodal drug with trace elements such as cobalt or selenium is also successful in treating the infection. So here this is the example showing the impact of dewormers in combination. So here if you can observe that drug 1 is having only 90% efficacy, and similarly drug 2 is also having only 90% efficacy. But when you are comparing the, or when you are giving this drugs in combination, the combination, if you see the efficacy of the drug is increased by 99.9% increase is there. So similarly here also the individual drug is having only 60% efficacy. So these two drugs are only having 60% efficacy. But when they are given in combination with the third drug which is having 95% efficacy, the treatment, the overall treatment efficacy is increased to 99%. Means we are having the additive effect of each drug which is showing the increased efficacy in the anti-helminthic treatment. And this particular approach is best in reducing the resistant worm population. So how can we reduce? Advantage of reducing the resistant worm population is we are diluting the resistant genes in a flock of worm population. By reducing or by killing the resistant parasite, we are successfully diluting the resistant genes. So which is also helping in efficacy or the success rate of the treatment. So these are some of the anti-helminthic combinations which are used in the veterinary practice. So combinations such as ivermectin and chlorsulon, so which is used against the roundworms and adult flukes. So similarly thiabendazole and refoxanide combination which is used against roundworms and adult flukes, and combination of levomizole with oxyclosanide with minerals such as cobalt and selenium. So this combination can help not only to fight against the infection of roundworm and adult flukes, but also helping the animal to cope up with the trace element deficiency. Means we are also inputting the nutritional requirement for the animal to show resilience to fight against the infection. And also combinations such as refoxanide with oxybendazole with cobalt and morantol in combination with diethyl carbamazine against the roundworms and lungworm infection.